Hi everyone, welcome to the next video from the channel Imperfectly Perfect Girl, and this is part 2. If you haven't watched part 1, I encourage you to go and please watch it. So you know the basis for this video. Just to give you a little recap, I was sharing my experiences and life when I moved here back in 2017. So taking the video further, let's talk about a point in depth, which is healthcare. So I want to share a personal experience in of my mom who came back on a tourist visa back in Feb 2023. This is a personal experience which only friends and families know about, and it's not to bring about the bad side or something, so a wrong side of the country, but it's just to let everyone know what really happens when you need emergency care or when you just need health care, and if you're not a permanent resident or citizen or on a temporary visa but just visiting another country, what really happens or what you can go or what you actually go through. So this started with my mom arriving here for the first time ever, traveling on an international flight from Mumbai to Sydney, and she came on the 8th of February 2023. She is a very healthy person. She never had any physical diseases or nothing, that sort of no major issues all her life. Just okay, and probably age related knee pain or something, but nothing major, no medications, always good in health. And her health was good. Her health was good all this while, but she just received a hurt on her feet and on the back near the ankle, and we just presume it's just out in the backyard. She must have hit her leg on something, and it just didn't heal. It just took like months to heal. We went to the GP every other day. They gave medicines, and it just did nothing happened. She just complained of the pain, and it's just not healing. And we knew from previous experiences back home that whenever she would hurt herself, it would take months to heal. So definitely there was something in her legs, but really we couldn't tell about it. That's when we went to the doctor, and he gave medications. He also did our x-ray. Everything was fine. But somewhere around July of 23, that's end of July, she experienced some symptoms of hallucinations, and she didn't know what was happening, and it happens all of a sudden. She was still taking the medications. So we presume it's because of that, but it went on, and on the 7th of August, I just let my team know, because I was working back then full time, that we had to take her to emergency and she had to be admitted. And at this point of time, she could no longer recognize us. So we waited like nearly 3 hours. This is in the public hospital near my home. We waited 3 hours and she got admitted. She was kept in the emergency ward on the ground floor. Doctors were still doing tests and trying to find out, but there was no solution. After a few days, she was shifted to the neurology ward, and there she again underwent a series of tests, be it MRI, CT scan, and every other test, blood test daily. Also, we did the lumbar puncture just to find out if there was something really related to dementia, but nothing. All good. Everything was fine. And it was 3 weeks. The first week, she couldn't recognize us, couldn't remember a thing, went back in the past. The second week, the same thing. The third week, she finally knew she was in a different place, in a hospital, and came back to terms, and the doctors couldn't find any solution. We were just surprised, and we were a bit worried because obviously she's in the hospital being admitted for 3 weeks, and the cost was like a lot, but the overseas health cover covered the cost as it was a totally new disease for her. We got her back home and she was fine. It was just few days. She hurt her toe, the small toe of the feet, and in the hospital probably because it had got black. And then back home, like nearly hit the bed, and then we were like wondering what happened to her, and she just was not feeling good, too much of pain, and that's when we took her to the hospital again to emergency, and then we waited from probably evening till night. They were just not letting her to go in, just because it's not like she's dying or something, but yes, she definitely had like too much pain in her toe. And then she got admitted, and after that we had to really pay from our pockets, because Medicare, sorry, the health cover didn't cover those costs. And the doctors mentioned that she would need undergo surgery. They did all the tests again. They said she has they would she the doctors mentioned that she would need to undergo surgery, and they would have to put stents. And we were pretty surprised, like, what is happening, because she doesn't have medical insurance, but nothing like the hospital, no, the government is going to not pay for her because she's a visitor only in this country. So we were just worried about that, and we wanted her to get better, and her toe was getting really bad. The doctors mentioned they could go ahead with the surgery, but again, it's so hard to find a date because there were so many other patients waiting, and they mentioned it would just cost around $33,000. That's excluding other costs, just the surgery itself, which was a big shock to us. We found out about doctors back home, and they could do it obviously for less, but it's not only the cost here, but it's also the time. They could do it more quickly. So we flew immediately to home. That's to Mumbai. We took the flight and we went, and we met the doctor after we landed, and he mentioned she had peripheral artery disease. So where the circulation in the leg stops, or that's where the whatever she had got, or a wound, or the toe couldn't heal. That's when he insisted do the surgery right away, and she was admitted in the hospital in Mumbai, and we had the surgery done. We had two surgeries, in fact. So one was the ballooning done in the legs, and the other one was not too. So doctors back here said that they would have to cut off the toe because it's got really bad. But the doctor back in India tried his best and saved the toe. He tried to just scratch it off, all the blackness or whatever was there on the toe, and saved her foot. So this is just an experience I wanted to share, that if someone gets seriously sick, don't wait, just rush them back home, especially in a country like India, where doctors, healthcare is so much more affordable and quicker. It can really save the life of a person. Yes, my mom saved herself from the toe, and definitely this is an experience to learn. This is not to say that the doctors here are bad, or the nursing staff, they're really good, but I just never had an experience with surgery. So this is just to let you all know, take care, take big action, and don't delay if there is an emergency. Thank you. See you all in the next video.